So the report refers to comes out of two different consumer surveys that we did in 2023. One being a survey around consumers' experience with their payers. So in that survey, pretty extensive. We've done this survey in some form or fashion since about 2013, and it usually includes around 10,000 consumers. It was 9,800-ish consumers last year, which includes both sort of national data as well as sort of targeted data for specific payers that are either clients or are part of like who we want to benchmark. And so in that survey, so that's focused on insured consumers and the relationship with payers. The other survey that that this is a part of is our patient experience survey, which is focused on people's relationship with their provider. And in that survey, it was over 8,000 consumers, and it was all consumers who had had some form of healthcare in the prior 12 months. And so those two surveys were all part of that. And in those surveys, and how it sort of relates to this information, we look at people across the journey. So we asked them questions about all the different journey points that they had access to. And then we look at, how does that affect switching? How does that affect, things like Net Promoter Score? How does that affect all kinds of different metrics, and what drives that? So what drives satisfaction and what drives switching, et cetera. So that's the context of the sort of the two data points or the two data positions that we started within that. So back to your question, what we've seen in this last survey, and I'll sort of split the answer into two. On the provider side, what we've seen is around 18% of consumers of patients switched providers because of an experience they had with that provider. So it was not they had to go to a different doctor. They switched because of something that caused them to switch. That's almost 1 in 5 patients switched for that reason. On the payer side, the people who chose to switch is closer to 1 in 10, which I think is a pretty consistent number. Back to that payer number, or back to the provider number, the interesting thing that we found is that that number has gone from it's basically returned to pre-COVID numbers. So we previously saw numbers around right around this number in our 2017 version. In 2021, it was about 10 points higher in terms of this, and now it's sort of returned. So it's been an interesting flow on the patient side, as we kind of got through COVID. Now we're back to sort of where we were prior to the pandemic. Yeah, this is where I think it's really interesting, and actually what seems to be the most surprising when we take this information to providers, because a lot of our provider clients and things will think, well, people leave because of their clinical experience. The reality is the primary reason people leave or cite as a factor of leaving is just their basic experience. So just it was a challenge to work with this provider. I had problems with the front desk. I didn't have a good way, like especially with young, more digital consumers. I couldn't make appointments online. I couldn't do some of the basic types of things online. So that sort of ease of navigation with providers, in our data shows it's like a 2x factor in why people switched providers versus the clinical experience, or even more so from the access. So while obviously clinical experience is important, it's almost like table stakes, right? People expect that, but why and we see this being even more and more of a factor with younger consumers is that ease of navigation and how easy it is to work with that provider being a primary driver of switching on the provider side. Yeah, and I think that the important things to remember are we need to as you know, payers and providers are thinking about this, right? They need to think about that foundation of experience, right? So you need to start from a foundation of, you know, what's that experience model going to be? Putting myself in the shoes of the person who's going to experience that, um, and in order to do that, right, in order to be able to understand, you need to have a core of data, right? You need to understand who people are, and not just who they are, but what are the characteristics that drive them to be in different places in their life, their mindset, right? We to think about it in terms of mindsets. So you need to have data to be able to understand, you know, is this the, you know, is this somebody who, um, is highly understanding of their, you know, is this, you know, of their both their healthcare situation and how to navigate? Is this somebody who doesn't, right? What's their ability to navigate the system? Where are they in their healthcare journey? You know, are they going through this journey as a patient or as a caregiver, right? So, you know, having a core of information and data on the people that you're dealing with, as an entity is critical, and that enables you to build, you know, an experience operating model around that. Um, and then, you know, thinking about then, you know, how do I, you know, then create that to a connected journey to where people are in their lives, right? So how do I engage them proactively where they are in a, you know, non-creepy or invasive type of way, right? How do I engage them proactively? How do I balance, you know, depending on that person, that human interaction versus the, you know, digital or machine, quote unquote, machine interaction, right? So how do I balance that and navigate that, you know, for different people, and completely understanding this can't be a one size model, you know, and so you know, we need to really think about, you know, how are we going to engage people where they are in their life, um, you know, and think of it as a life centric type of, you know, experience for that person.